everyone. Thank you for contacting Wave Clinical Support. From your request, I see you have a patient who came in for an unrelated eye problem and carrying their contact lenses in their case, basically, due to comfort issues and vision issues. And so if we look at this case, it looks like there's basically three issues going on. One is a vision issue. Secondly, we've got obviously a coding problem. And then third, we've got some late-day comfort issues. So if we talk first about the vision, looking at your powers, it looks like you have plenty of bifocal power in these lenses, so there shouldn't be, this patient should be seen reasonably well out of these lenses for reading. If they're having that much difficulty, obviously we think about centration issues. Are these lenses not staying centered enough for the bifocal? Are they dropping down and getting into the distance zone? Could it just be that those bifocals, the PSC, and probably some associated nuclear sclerosis, is that really getting in the way of the overall quality of the vision? And of course, if they're getting all gunked up and drying out, that'll contribute to the vision issues. So let's talk about the second part, the coding issue. When we hear coding, the first thing I start thinking about is, do we have a tear film quality issue? Do we have some meibomian gland disease? Do we have a underlying dry eye like a rheumatoid factor or a rosacea? I would look very closely at those eyelids, see if you need to express them, see what's going on with that, and if you have an underlying tear film quality issue, that certainly can contribute to a lot of the coding and filming issues. And then, of course, those will also contribute to late-day dryness. If we look at the late-day discomfort issue, when we look at the designs, overall they look pretty good. I noticed that you have a little bit steeper here to the central part and a little bit more touch out here peripherally. I suspect that's to try to help keep these lenses centering a little bit better. One thing we may be getting is, since you have more of a concentrated area of touch out here in this outer landing zone, you might be running into, if you have a tendency toward dryness, you might be running into some awareness just from that. What I would probably recommend doing is trying to get this a little bit more evenly distributed, so you have a little bit more even touch throughout this entire back surface of the lens. And there's a couple ways to do it. If you remember from your clinical training, there's basically axial mode and tangential mode. Axial tends to fit a little more steeply and seems to do a little bit better job of representing the central topography and a little less accurate when it comes to this peripheral area. And from the tangential, it tends to be just the opposite. It tends to represent this peripheral cornea quite well and not quite as closely in the central part. And what I find, if a lot of these patients have poor late-day comfort, sometimes I do better in tangential design because I feel like I get a little bit nicer alignment out through here and maybe less of the tendency for these things to dig in, almost like what I refer to as the cookie cutter effect that we get with some of these axial designs. So if we try to get this a little bit more closely aligned, I'm going to go over to this left lens just to sort of demonstrate what we might consider. I'd probably bring this zone maybe a little bit more, spread it out just a little bit more on this eye. And we'll go over here and just let the Wave software do a little work and see if we can get that any better aligned to that cornea. I notice he went with freeform on this left eye because of this inferior area. And it's probably fine. You may be able to get by with a G-SIM design also, since you don't have that much corneal cylinder overall, but we'll take a look. I'll let the software finish up here. And so if we look, we got a little bit more even alignment through these zones. I might even try going to G-SIM, see what we have here. And you're probably still going to have a pretty nice alignment through there. I'd probably make sure you get enough tear exchange. You bring that up a little bit. Make sure you have enough tear pumping out the outer areas. And if you want to try this in tangential, you could even go over here. Tangential, if you look over this now, you've got, it looks like that same design has a little bit of a steeper area through here. And so if you want to get a little closer alignment in that peripheral zone, again, tangential tends to look, I think, a little bit more accurately in this area at the topography, the relationship there between the design and the cornea. We'll give that a moment here to readjust itself. lens that has a little bit more even distribution of that bearing area through here. And I think this lens, if you can get to line up a little bit more closely through a larger area of that cornea, might help reduce a little bit of this bearing that may be contributing to late day comfort. To summarize that, I would probably, as you did, clean up the lenses really nicely, look at the eyelids, check out for lid disease, check out for dry underlying drying issues. I would look at either axial or tangential design, maybe bring this area a little bit more uniformly in through here to see if you can redistribute the weight of that lens or the bearing of that lens more symmetrically through the whole area. Make sure you leave enough edge lift for tear exchange. And I think those little subtle adjustments should help out with getting these lenses to be a little bit more comfortable as the day goes. With that said, if we continue to struggle with the vision, you may even consider referring this patient to one of our ophthalmological colleagues for one maybe the bifocal implants to see if they have any, might be a candidate for surgery such as that. Anyways, I wish you well with this case, and thank you for contacting Wave Clinical Support. Have a great day.